Hello to all of our friends in Malaysia. So this is just a very short PowerPoint presentation to give you an overview of our department. And as the largest teaching hospital in Southern Taiwan, we are very committed to the education of future physicians. So in addition to giving our medical students a diverse clinical experience, we are also very involved in academic research. So hopefully by the end of this presentation, you will be interested enough to give us a visit. So first of all, as the largest children's hospital in Southern Taiwan, we have a total of 256 beds, including a 20-bed pediatric ICU and a 33-bed neonatal ICU. With so many patients being admitted at any time at our hospital, there's always ample opportunity for residents and medical students to gain hands-on clinical experiences. So in addition to general pediatrics, our department has a total of 13 pediatric subspecialties. And so they're usually in several settings, including the clinic, the general ward, and also our two ICU settings. So our cardiology department specializes in pediatric interventional cardiology, congenital heart diseases that would have traditionally been treated with surgery can be repaired by catheterization and or stent implementation or closure. So we also have extensive experience with ECMO placement in our pediatric ICU, especially for patients with acute myocarditis and heart failure. We also have a level 4 neonatal ICU, so meaning that we are the largest, highest level neonatal ICU center in our region, and we can handle the most difficult cases. There are several innovations at our department. For example, we can use NAVA, which is a neurally adjusted ventilatory assist to detect diaphragm electrical activity and to simultaneously give ventilation assistance. We also have a new non-invasive laser acupuncture for neuropathic patients. So in traditional Chinese acupuncture, you can see in the top photo, you have to use needles, but with a laser acupuncture, you can use lasers to give acupuncture in a non-invasive way. So we also actively encourage our residents and medical students to participate in clinical research. At the time being, we have 7 full professors in a variety of subspecialties who are more than happy to mentor our residents and medical students. In fact, many of our residents have completed and published research papers during their residency. So if you're interested in research, we have a lot of resources at our hospital to help you expand your interests. We also have routine teaching activities every week in a variety of settings. So teaching rounds are conducted once a week where we discuss a case at the bedside in our pediatric ward. Students are also assigned to clinic sessions at our Well Baby Clinic and other subspecialties. Morning meetings are held daily. And so this slide is our morning meeting schedule. We have meetings in our pediatric conference room from Mondays to Thursdays, and a large assembly in the auditorium on Fridays. So morning meeting in our department usually consists of case discussions and scheduled lectures. We also have combined meetings with our radiology, OB-GYN department, or pathology, and they're held about once or twice a week. So because our morning meeting schedule is usually targeted to a resident, we also have a separate core lecture series that is tailored to our medical students, which covers core topics in pediatrics, such as pediatric airway disease and nutrition every 2 weeks, 6 weeks actually, sorry. Workshops are usually scheduled once or twice a year. The most important of which, of course, is our advanced pediatric life support and neonatal life support workshops, where all our residents are required to gain a certification. We also have bedside a sonography workshop and various research forums where our students and residents can hone their clinical and research skills. Residents are also encouraged to share their research projects in our yearly resident research forum. New meetings are more ad hoc, so sometimes we have visiting professors from other hospitals and other universities or from our government research body, the Academia Sinica, and they can come and give lectures in their areas of expertise. Other times we have subspecialty conferences in neonatology or for example, emergency medicine, where doctors from other hospitals will present their case for discussion. In our department, we also have 4 specialty centers where children with complex diseases can receive multidisciplinary care. For example, for children with Kawasaki disease, we have specialized clinic hours where children can be seen by an immunologist, a cardiologist, and receive a follow-up cardiac echo on the same day instead of having to schedule several different appointments with different doctors. Okay, so this is a picture of our Kawasaki Disease Center. As an East Asian country, Taiwan has one of the highest incidence rates of Kawasaki disease in the world. At our Kawasaki Disease Center, parents can have access to patient education regarding the disease, and our Kawasaki Disease Case Manager will help coordinate follow-up visits for the patients. Because Kawasaki disease is often mistaken for other febrile illnesses in childhood, parent education and public awareness is very important. Obviously, having the same lecture every year is kind of boring, so we try to increase parent and child engagement by tying our public education events with holiday themes. We also have several ongoing studies regarding the genetics and pathogenesis of Kawasaki's disease. Okay, so this is a picture of our rare childhood neurologic disease center. And so a main focus of this center is parent education regarding how to prepare a ketogenic diet. So seizure disorders are often associated with abnormal cell metabolism. So in patients with seizure disorders who have poor response to medications, a ketogenic diet has been found to decrease seizure frequency. However, because a ketogenic diet requires parents to avoid foods that are high in carbohydrates and sugar, it's very difficult for parents to adhere to. That's why at our center, we try to educate parents and children who would like to try a ketogenic diet through interactive games, illustrated picture books, and a handbook that parents can take home. So here are a few examples of the educational materials provided at our neurology center. So you can see that there are books and CDs and interactive games. This is a photo of our Child Development and Protection Center. So as a large medical center with a comprehensive pediatric intensive care unit, it is unfortunately inevitable that we may encounter children who are actually victims of child abuse. These children not only need multidisciplinary care from a variety of subspecialties, they also need intervention from social workers and law enforcement personnel. One of the biggest aims of our Child Protection Center is to coordinate care and follow up between these different agencies. Okay. So we have arranged specific clinic hours where patients with developmental delay or have multiple sequelae from child abuse can receive care from our neurologists and therapists without having to schedule multiple hospital visits. This is a photo of our therapy space. It's a bright and playful space for our therapists to conduct patient evaluation, therapy, and education. And so this is our 4th medical center, is for patients with hemophilia. So hemophilia is a congenital clotting disorder and requires comprehensive care from physicians, nurses, therapists, and social workers. They also require lifelong infusion of clotting factors. We also have patient and parent associations for children with childhood cancers. So cancer is an extremely stressful situation for children and their families. And so having a community where parents and patients can find adequate assistance and emotional support is essential. We have also partnered with the Make-A-Wish Foundation, where children can quite literally make a wish, for example, to meet a famous baseball player or to take a trip somewhere. and more importantly, to give children with cancer something happy to look forward to. So I think, oh, oops. So after this short presentation, I just have a few questions to ask you, the listener. For one, are you intrigued yet? And do you love pediatrics? Are you looking for an exciting, dynamic, and educational learning experience? Well, there's only one way to find out if we are as awesome as we say we are. Come visit us at Changgen Memorial Hospital in Kaohsiung. My Malay isn't very good, but I'm told that come visit us in Malay is Selamat Datang. So Selamat Datang. We look forward to having you. Thank you. Bye-bye.